Sorry I couldn't be there today. Um, to me, public health is the efforts to prevent diseases and promote healthy lifestyles in individuals from all walks of life, um, all different classes, all societies, anything. Through methods like a billboard with promoting hand washing or um, education seminars about using contraceptives or handing out contraceptives, anything like that. But that's enough of what we think about public health. Here's what some of your peers at SU thought about public health and the downfalls and how it could be improved.
Public health to me is healthcare for people who pay taxes.
Public health is anything that improves the lives of citizens across any nation.
Public health to me is how healthy a society is.
Public health is health benefits for all citizens of the United States, no matter your religious faith, your ethnicity, your age, or your sex.
Public health to me is the notion of just our society and the health that we maintain in general, the health care that we have, and the issues with that system.
A lot of people are uninsured, especially working poor. Like 9.3 million people in Texas are uninsured. It's like 1 in 8 or something. And you can't afford health insurance, and sometimes, especially, you're supposed to get it through your job, but if you are poor, you usually don't get it if it's contract labor. And so universal health care would fix the problems of people being uninsured. And another problem is long waiting rooms in the ER because people are uninsured. They put off going to the doctor and
Well, first there's the fact that a lot of people can't afford healthcare in the first place for various reasons, which are, can be overlooked or can be fixed.
There are lots of problems with public health. A lot of people go uninsured, and the cost of it really is the biggest issue. On top of that, we're in a doctor shortage. The amount of people who've been entered into medical school since 1980 hasn't increased. So we don't have the supplies, and what we do have is too expensive for a lot of people to get.
Preventative care, we could educate more people so they don't have any of those diseases that can be prevented earlier in life.
In the United States in particular, we have a problem because there's several different groups of society that we're trying to serve with public health needs. For example, urban areas are going to have a very different set of needs than rural areas might. In urban areas, you might have incredibly dense populations that have limited resources at a hospital, but in rural areas, for instance, a public health need would be that it takes 2 hours to get to a hospital, or there's not, a woman who can deliver babies or a man who can deliver babies close by. So I think servicing the needs of different groups is the biggest obstacle in public health.
If we can actually set up like a well thought out and planned universal healthcare system, we could probably improve public healthcare, at least here in the United States.
Insurances need to be covered by the government instead of the work. So because if you lose your job, you lose your insurance. So they need to move away from having privatized insurance through your job and have it more through where you live or the government, so you can never lose
I think a problem in public health is education. I think education should be provided to everyone, and that everyone should know about taking care of themselves and how to prevent diseases.
It could become better is that because public health encompasses several different, even sub-disciplines, like I mentioned surveillance, I mentioned prevention, there's also technology that can be used in public health, I think, and epidemiology. I think if the incredible research that all these scientists and researchers within public health are doing can become more transdisciplinary, I can say that word better, then you would have increased communication and maybe more creativity with approaching public health problems and designing better and implementing better solutions.
Public health can be improved by maybe setting some sort of plans in place that will help people with their insurance plans and getting help that they need to make sure that they're healthy.
The only thing we can really do to improve public health is to initiate some kind of change. I'm not particularly a supporter of universal health care, but I do believe that healthcare reform could involve giving scholarships to students to go into medical school so we have more doctors, making sure we have the supplies we need, making the healthcare industry better suited for our nation instead of only suitable for the people with money who can afford it.